If you wake up with dry mouth, your body is warning you. Almost nobody knows this. Imagine a scenario where the subtle signals your body sends are not mere inconveniences to be brushed aside, but profound warnings of deeper, more serious health challenges. Consider for a moment conditions such as compromised circulation, a noticeable decline in memory, or even the formidable threat of heart failure. Each of these can unexpectedly originate from a symptom as seemingly benign and commonly overlooked as waking up with a dry mouth. For most individuals, the morning routine after experiencing such dryness involves little more than a simple rollover, a reach for a glass of water, and then a quick dismissal of the sensation as they commence their day. Yet, what if this persistent morning dryness bears no relation to simple thirst? What if, instead, it represents an urgent message from your own physiology, a quiet warning that has potentially been broadcast for months or perhaps even years, a message that no one has ever truly empowered you to decipher or comprehend? This unsettling possibility is what compels me to pause every time I consider it. The prevalence of chronic morning dry mouth is far more significant than most realize, affecting nearly 1 in 3 adults once they reach the age of 60. What is particularly alarming is that in the vast majority of these cases, this persistent dryness is entirely disconnected from the amount of water consumed the previous night. It has absolutely no bearing on your hydration habits before bed, none whatsoever. Despite this critical insight, the subject of chronic morning dry mouth remains conspicuously absent from most routine conversations. It is not typically discussed during visits to local pharmacies, nor is it a topic that frequently arises during annual medical checkups. This vital conversation, quite simply, is not happening with the urgency and attention it deserves. I urge you to remain engaged through the entirety of this discussion, because the primary cause I am prepared to unveil today is something that might be silently residing in your medicine cabinet or perched on your nightstand at this very moment. This seemingly innocuous item may be inflicting damage far beyond the mere discomfort of a dry mouth, silently eroding the health of your kidneys, straining your heart, and impacting your brain function all at once. I am Dr. Amelia Lawson, a medical physician with a decade and a half of intensive clinical experience, particularly focused on advancing the health and well-being of adults aged 60 and above. Throughout my extensive career, I have had the privilege of sitting with countless men and women who initially approached me with what they perceived as minor, almost trivial complaints. However, upon closer examination and a more comprehensive investigation, we have frequently uncovered serious, often deeply entrenched, underlying medical conditions that had been subtly veiled by these dismissed, seemingly insignificant symptoms. Morning dry mouth stands as a quintessential example of precisely this kind of symptom. On the surface, it appears deceptively simple, almost too commonplace to warrant concern. Yet, beneath that unassuming exterior lies the potential for truly life-altering implications. The information I am about to share with you directly challenges a pervasive societal belief that many of us have quietly absorbed and accepted: the notion that aging is synonymous with increasing discomfort, and that a dry mouth is simply an inevitable, unremarkable aspect of growing older. I wish to be unequivocally direct and transparent with you. This is not the complete truth. After observing patients endure unnecessary suffering for over a decade, precisely because this critical information failed to reach them, I am no longer willing to remain silent on this matter. If you find this information beneficial and insightful, please consider pressing that like button immediately. Your action ensures that this vital message reaches the individuals who genuinely stand to benefit from it most. Let us now delve into the intricate physiological processes actually unfolding within your body on those mornings when you awaken with a sensation as though your mouth has been packed with cotton. Your oral cavity relies critically on a continuous, uninterrupted supply of saliva. It is imperative to understand that saliva is not merely water. It is, in fact, an extraordinarily sophisticated biological fluid. It acts acts as a dynamic carrier for a complex array of enzymes crucial for initial digestion, potent antimicrobial proteins that combat pathogens, essential minerals for tooth remineralization, and a host of protective compounds. This sophisticated mixture tirelessly defends your teeth from decay, safeguards your gums from inflammation, protects your throat from irritation, aids in the intricate processes of digestion, and bolsters your immune system around the clock. When the salivary glands, which are the biological factories of this crucial fluid, begin to slow their output, or when other interdependent systems within the body start to encounter difficulties, the overall production of saliva inevitably diminishes. And when this reduction in saliva production becomes significant, your mouth undeniably dries out, a sensation that is particularly pronounced overnight when you are not actively drinking, speaking, or engaging in any activities that naturally stimulate the flow of saliva. It is a well-established physiological fact that after the age of 60, the human body naturally produces approximately 30 to 40% less saliva than it did during an individual's 40s. This inherent reduction alone creates a tangible vulnerability within the oral cavity and beyond. However, this situation escalates into a genuinely hazardous state when combined with the 7 specific causes I am about to meticulously detail. This is because none of these contributing factors merely induce oral dryness in isolation. Every single one of them serves as a significant indicator pointing towards a deeper, more profound underlying issue unfolding within your body's intricate systems. As a practicing clinician, one of the most concerning statistics I consistently observe is this. Chronic dry mouth is unequivocally associated with a startling 45% higher risk of systemic infection in adults over the age of 60. Saliva, quite literally, constitutes your mouth's primary frontline immune defense mechanism. When this vital protective barrier is compromised or removed, bacteria, fungi, and viruses are afforded a direct, unimpeded pathway into your bloodstream, escalating the risk of widespread infection. Therefore, we shall systematically examine all 7 of these critical causes, progressing from those that are generally considered the least serious to the singular factor that provokes the most profound concern in my clinical judgment. By the culmination of our discussion, you will possess the precise knowledge of what specific signs and symptoms to vigilantly observe, what crucial questions and concerns to articulate to your physician, and what proactive adjustments you can implement into your daily routine, commencing as early as tonight. Before we embark on this detailed exploration, I would like to pose a question of a personal nature to you. For how long have you been waking up with the persistent sensation of a dry mouth? Has it been a matter of a few recent weeks, perhaps several challenging months, or has this been an ongoing experience spanning many years? I invite you to share your candid answer in the comments section situated below. I personally review every single response, and your contribution not only helps me understand the scope of this issue, but more importantly, it helps others who are watching this realize that they are not navigating this experience in isolation. The 7th item on our comprehensive list identifies a cause that I encounter with significant frequency in my practice, yet it is simultaneously the most consistently dismissed and underestimated factor: mouth breathing during sleep. Before you are tempted to quickly bypass this point, perhaps thinking it is too obvious or entirely harmless, it is imperative that you fully absorb a crucial piece of information. Mouth breathing during sleep is almost never merely an innocuous habit. In my extensive clinical experience, it nearly always functions as a symptom, a visible manifestation of some other underlying physiological process or condition. This subtle yet profound distinction carries enormous clinical significance. When you consistently breathe through your mouth throughout the night, there is an uninterrupted flow of air directly across the delicate tissues of your tongue. your palate, and the sensitive lining at the back of your throat. This continuous current of air relentlessly evaporates moisture from these surfaces at a rate that your salivary glands are simply incapable of keeping pace with while you are in a state of sleep. The direct, uncomfortable consequence of this phenomenon is that characteristic sandpaper-like sensation that greets you upon waking. It often presents with cracked lips, a tongue that feels thick or appears coated, and occasionally a sore throat that surprisingly bears no relation to any infectious illness or cold. However, the aspect of mouth breathing that deeply concerns me, extending far beyond the mere symptom of dry mouth itself, is its frequent association with more serious underlying health issues. Mouth breathing during sleep is very often driven by conditions such as chronic nasal congestion, a deviated septum that obstructs airflow, the presence of nasal polyps, or, most critically, sleep apnea. Sleep apnea, in particular, is not a condition that should ever be casually brushed aside or underestimated. Extensive and rigorous research has unequivocally demonstrated that untreated sleep apnea is directly linked to a substantial 60% increased risk of stroke and a significant 40% increased risk of heart failure. If you routinely awaken with a dry mouth and also exhibit other related symptoms such as snoring loudly, feeling persistently unrested, even after what appears to be a full night's sleep, or if a close family member or partner has observed instances where you momentarily stop breathing during the night, please do not simply file these observations away as just the way you sleep. I strongly urge you to initiate a conversation with your doctor about undergoing a sleep study. This single conversation and the subsequent diagnostic investigation could potentially hold more importance for your long-term health than you currently realize. For those individuals whose mouth breathing is not found to be connected to sleep apnea or other serious underlying conditions, the practical and effective solutions are generally straightforward and readily implementable. Wearing a simple nasal strip across the bridge of your nose before bedtime can significantly enhance nasal airflow, gently encouraging your body to breathe through its intended pathway. Introducing a humidifier into your bedroom, carefully maintaining a humidity level between 40 and 50% can dramatically reduce overnight moisture loss. Adopting a side sleeping position also tends to diminish the propensity to breathe through the mouth. Furthermore, a small strip of specialized surgical tape, delicately placed vertically over the lips prior to sleep, a technique that sleep specialists have employed successfully for many years, can gently and effectively train habitual mouth breathers back towards the more natural and beneficial nasal breathing. Many individuals who adopt these simple strategies report noticing a genuine and significant difference within the very first week of implementation. The sixth common mistake I consistently observe is one that, on the surface, appears entirely logical and intuitive until one fully grasps the underlying physiological reasons why it proves ineffective: drinking copious amounts of water right before bed. Most individuals who awaken with a parched mouth naturally assume that the simplest and most direct remedy is to increase their fluid intake just prior to sleep. Consequently, they proceed to do exactly that, often consuming a large glass of water just before extinguishing the lights. However, they subsequently awaken to find their mouth just as dry as it was before, sometimes even more frustrated because they felt they had diligently followed the correct advice, yet nothing seemed to change. Herein lies the critical explanation. Your body does not hydrate in real time in the way many people mistakenly perceive. When you ingest water, it typically takes a significant duration, anywhere from 30 minutes to a full 2 hours, for that fluid to be properly absorbed into your bloodstream, distributed effectively to your various tissues and cells, and then made available for essential physiological functions, such as the intricate process of saliva production. Therefore, water consumed at, for example, 10 chiat at night is providing very little, if any, substantial benefit to your oral moisture levels at 6 ground the following morning. The crucial window of opportunity for effective overnight hydration has already elapsed by then. The actual root of the problem often lies in what transpired, or more accurately, what failed to transpire, during the preceding afternoon hours. Compelling research has revealed that adults over the age of 60 who did not maintain adequate and consistent fluid intake between the hours of noon and 4 in the afternoon were a significant 62% more likely to experience considerable overnight dry mouth when compared to those who remained consistently hydrated throughout the entire day. A 62% difference is by no means a negligible disparity. It represents a profound impact. After reaching 60, managing hydration naturally becomes an even greater challenge because the body's intrinsic thirst mechanism itself tends to become genuinely less reliable with advancing age. It is entirely possible to be medically dehydrated to a meaningful degree and yet experience no particular compelling urge to drink fluids. Furthermore, many individuals understandably and quietly reduce their fluid intake during the late afternoon to mitigate the likelihood of disruptive nighttime bathroom trips. While this is a completely rational desire, it inadvertently creates a growing hydration deficit that reaches its peak precisely at a time when you have no effective means to correct it. The genuine solution, therefore, is not to consume more water immediately before bed, but rather to strategically front-load your hydration earlier in the day. Aim to consume approximately 6 to 8 ounces of water with every meal and with every afternoon snack. And here is a small, yet remarkably effective, professional tip. Consider adding a tiny pinch of high-quality sea salt and a fresh squeeze of lemon to your afternoon water intake. This simple addition actively supports your body's essential electrolyte balance, which in turn helps your cells to actually retain the fluid you consume, rather than allowing it to merely pass straight through your system without providing lasting hydration. Number 5 on our list is a cause that frequently catches almost everyone by surprise, primarily because we seldom associate the nuances of nutrition as a direct causative factor for something that manifests in your mouth with predictable regularity every single morning. Your salivary glands are far from being passive anatomical structures. They are, in fact, metabolically active tissues, diligently working entities that demand a precise supply of specific nutrients to perform their functions optimally at the cellular level. In adults over 60, 2 particular nutritional deficiencies have been observed to compromise and degrade salivary gland function with alarming speed and efficiency, often more rapidly than almost any other factor. The first critical nutrient is vitamin A. This essential vitamin is absolutely fundamental for maintaining the robust health and structural integrity of every mucous membrane found throughout your body. This includes, crucially, the delicate lining of your mouth, your throat, your nasal passages, and indeed, your entire digestive tract. When levels of vitamin A fall below an optimal threshold, these vital mucous membranes become noticeably thinner, progressively drier, and increasingly less functional. Research has empirically shown that adults over the age of 60 with diminished vitamin A levels exhibited a substantial 41% reduction in their resting saliva production, in stark contrast to those individuals with adequate vitamin A levels. This is by no means a subtle or minor effect. It signifies that your salivary glands are operating at a mere fraction of their inherent capacity, struggling to perform their fundamental role. The second crucial category encompasses the B vitamins, with particular emphasis on B3, commonly known as niacin, and B12. A deficiency in niacin directly interferes with and disrupts the intricate nervous system signals that are responsible for initiating and triggering saliva production in the first place. Conversely, a deficiency in vitamin B12 often leads to the tongue becoming inflamed, acquiring an abnormally smooth appearance, and feeling persistently dry, a recognized medical condition termed glossitis. Together, these specific B vitamin deficiencies conspire to create a dry mouth sensation that no amount of water will ever fully resolve, precisely because the fundamental problem is not a simple lack of hydration, but rather a profound impairment of cellular function. It is particularly important to note that after the age of 60, the absorption rate of B12 declines significantly, primarily due to a natural reduction in stomach acid production. Furthermore, compelling research suggests that up to 30% of older adults may have inadequate B12 levels without any conscious awareness of this deficiency whatsoever. For those seeking to address these nutritional needs through dietary sources, focus on incorporating sweet potatoes, a variety of dark leafy greens, and eggs for a rich supply of vitamin A. For B12, prioritize lean meats, various types of fish, and dairy products. However, for a substantial number of adults over 60, dietary intake alone may not be sufficient, and careful supplementation becomes a necessary consideration. Look for a high-quality B-complex supplement that contains at least 1,000 micrograms of B12 in its methylcobalamin form, which is widely considered the most bioavailable and readily absorbable version available. As a practical and highly effective professional tip, remember that vitamin A is a fat-soluble vitamin. This means it absorbs significantly more effectively when consumed concurrently with a small amount of healthy fat. A light drizzle of olive oil over your salad or incorporating a few slices of fresh avocado with your meal can make a genuine and measurable difference in its absorption. Number 4 represents a combination of symptoms that I address with the utmost seriousness in my medical practice. If this particular scenario resonates with your personal experience, I want you to receive this information with absolute clarity, not with fear, but rather with the empowering understanding that early knowledge is truly paramount in mitigating potential health risks. If you are consistently waking up with a dry mouth and concurrently you find yourself needing to get up to urinate more than once during the night, this specific pairing of symptoms constitutes a distinct clinical warning flag that I unequivocally refuse to overlook. When observed together, these two seemingly disparate symptoms are among the earliest and most telling indicators of uncontrolled blood sugar, and in a considerable number of cases, they can signal the presence of undiagnosed type 2 diabetes. Let me elucidate the underlying mechanism. When blood sugar levels ascend above a certain critical threshold, the kidneys are compelled to work in overdrive, tirelessly laboring to filter and excrete the excess glucose from the body. To accomplish this arduous task, they draw significant amounts of water from the body's various tissues. This internal fluid loss effectively dehydrates you from the inside out. And one of the very first places where this profound dehydration becomes perceptible is in your mouth, particularly overnight, when there is nothing you can actively do to compensate for the continuous fluid depletion. What renders this particular observation so critically important is the typical timeline involved. Groundbreaking research has definitively established that morning dry mouth was a symptom reported by a staggering 63% of adults who were newly diagnosed with type 2 diabetes. Even more remarkably, the majority of these individuals had been experiencing this specific symptom for over a year prior to receiving their formal diagnosis. This means that for over a year, their bodies had been consistently transmitting a clear signal that something was profoundly amiss every single morning. I'm reminded of a particular patient of mine, a vibrant, retired woman in her early 70s, who was exceptionally sharp and maintained an active lifestyle. She initially presented to my office for an entirely unrelated concern. As she was preparing to leave, almost as an afterthought, she casually mentioned her recurring dry mouth. I seized the opportunity to ask a few targeted, probing questions. Was she waking during the night to use the bathroom? Yes, she confirmed, regularly. Was she experiencing unusual afternoon fatigue? Indeed, she responded. Based on these cumulative symptoms, I promptly ordered a fasting blood glucose panel for her that very same week. Her test result returned at 148 milligrams per deciliter, a clear indicator. She had type 2 diabetes and had been unknowingly living with it for well over a year, completely unaware of the internal battle her body was fighting. Within a mere 4 months of implementing carefully targeted dietary changes, incorporating consistent daily movement, and supplementing with specific compounds like berberine and magnesium glycinate, her fasting glucose levels had completely normalized. At her follow-up appointment, she shared with me, her voice filled with relief. I finally feel like my body is working with me again, not against me. This profound statement perfectly encapsulates what catching something early truly looks like. It is not a moment of crisis, but rather a precious window of opportunity to regain control and restore health. Number 3 on our list addresses a medical condition that impacts an estimated 4 million Americans. Astonishingly, despite its prevalence, the average patient experiences a frustrating delay of nearly 3 years from the initial onset of their symptoms to the eventual moment they finally receive a correct diagnosis. 3 years is not merely a gap in medical practice. It represents a profound deficiency in the crucial conversations that ought to be taking place within examination rooms. The condition in question is called Sjogren's syndrome. This is a chronic autoimmune disorder in which the body's own immune system, in a misguided and harmful attack, mistakenly targets and destroys its own moisture-producing glands. Primarily affected are the salivary glands, which produce saliva, and the tear glands, responsible for lubrication of the eyes. The direct and distressing result of this autoimmune assault is a persistent, unrelenting dry mouth, coupled with chronic dry eyes that often feel gritty or scratchy, significant difficulty in swallowing food, and in more advanced or severe cases, widespread systemic involvement. This can manifest as debilitating joint pain, overwhelming fatigue that no amount of rest can alleviate, and even detrimental effects on vital organs such as the kidneys and lungs. It is particularly noteworthy that women over the age of 60 are disproportionately affected by Sjogren's syndrome, accounting for nearly 90% of all diagnosed cases, highlighting a clear demographic vulnerability. So, a critical question arises: why does it take such an extended period to accurately identify this condition? The answer lies in the unfortunate tendency for each individual symptom to be treated in isolation rather than being viewed as interconnected pieces of a larger puzzle. The dry mouth is frequently dismissed as an inevitable consequence of aging or simply attributed to inadequate hydration. The chronic dry eyes are often explained away as a result of excessive screen time or dismissed as mere seasonal allergies. The accompanying joint pain is typically labeled as common arthritis, a separate and distinct ailment. Consequently, no single physician connects the seemingly disparate dots, and the insidious underlying autoimmune process continues its destructive course, completely unchecked and undiagnosed throughout this protracted period. The crucial diagnostic clue that I wish for you to carry with you, etched firmly in your understanding, is this: if your persistent dry mouth is consistently accompanied by eyes that feel chronically dry, gritty, or experience a burning sensation, and especially if you are a woman over the age of 60, please, I implore you, specifically ask your doctor about Sjogren's syndrome by its precise medical name. A straightforward blood test designed to measure the presence and levels of 2 specific antibodies, anti-SSA and anti-SSB, can accurately identify the condition in the majority of cases. You are absolutely entitled to request this diagnostic test. Do not passively wait for someone to offer it to you. While there is currently no definitive cure for Sjogren's syndrome, it is important to emphasize that there are highly effective treatments available. These treatments are specifically designed to proficiently manage the array of symptoms and, critically, to significantly slow the overall progression of the disease, thereby preserving quality of life. For immediate palliative relief while you are diligently seeking definitive answers and pursuing a diagnosis, sugar-free gum that contains xylitol stands out as one of the most accessible and effective tools available without the need for a prescription. It actively stimulates the production of natural saliva and simultaneously powerfully inhibits the growth of decay-causing bacteria, which are unfortunately encouraged by the dry mouth environment. Number 2 on our list is a cause that most people would likely never even remotely connect to the seemingly minor symptom of a dry mouth. However, the connection is undeniably real, thoroughly documented by scientific research, and it is a piece of vital information that every adult over the age of 60 absolutely deserves to be aware of. Your salivary glands, complex as they are, do not operate in an isolated or independent fashion. Instead, their functions are intricately governed by the autonomic nervous system, and more specifically, by its parasympathetic branch. This particular division of the nervous system is responsible for overseeing the body's essential functions related to rest, recovery, and digestion. When this vital system, the autonomic nervous system, becomes compromised or experiences dysfunction, a direct consequence is a notable decline in salivary activity. The mouth, in turn, becomes persistently dry. What renders this particular observation profoundly significant is the established fact that autonomic nervous system dysfunction is a recognized and critical early feature of both Parkinson's disease and Lewy body dementia. Furthermore, extensive research has conclusively demonstrated that these subtle yet distinct autonomic changes can manifest a considerable period, often 4 to 6 years, before the classical motor symptoms, such as tremors, rigidity, and bradykinesia, typically emerge, which are usually what lead to a formal diagnosis. This brings to mind another patient of mine, a retired man in his late 70s, who possessed a methodical nature and a quietly observant disposition. Over the course of several visits, he had consistently mentioned a persistent dry mouth. We had diligently explored and systematically worked through all the obvious potential explanations, reviewing his medications, assessing his sleep position, and optimizing his hydration habits. Despite our concerted efforts, nothing seemed to fully resolve his discomfort. Then, during one particular appointment, his wife, almost in passing, made a crucial observation. She mentioned that he had stopped recognizing the familiar and comforting smell of his morning coffee. He too had noticed this change, but had said nothing, assuming it was an unrelated, minor quirk of aging. It was not unrelated. This subtle cue was the missing piece of the puzzle. I promptly referred him to a neurologist. Subsequent imaging and neurological assessments confirmed an early diagnosis of Parkinson's disease. Understandably, he was shaken by the news, but precisely because we had identified it early, he was able to immediately commence neuroprotective therapy and meticulously construct a comprehensive care plan well in advance of the development of any significant motor symptoms. 3 years later, his quality of life remains genuinely good and remarkably preserved. At a recent follow-up visit, he recounted to me, "I almost didn't mention the dry mouth. I thought it was too small, too insignificant to bring up." His words serve as a powerful reminder. Nothing is too small to bring up to your doctor. Your body is perpetually communicating with you. Our collective responsibility, yours and mine together, is to diligently learn how to truly listen to its subtle yet critical messages. The leading cause, number 1 on our comprehensive list, is the factor I encounter most frequently and consistently in my clinical practice. It is also the one that is most persistently overlooked, most poorly communicated to patients, and, in my professional opinion, most deserving of a direct, candid, and utterly honest conversation. We are referring, of course, to medications. A staggering number, over 500 commonly prescribed medications, explicitly list dry mouth as a known side effect. Think about that for a moment. Over 500 different pharmaceutical agents have the potential to induce this very symptom. For adults over the age of 60, who, on average, take 5 or more prescription medications daily, the cumulative impact of these drugs on both salivary gland function and, more alarmingly, on overall brain health can be profoundly significant. The specific drug classes most frequently implicated in causing dry mouth include a wide array of commonly used medications: antihistamines, various types of antidepressants, blood pressure medications, bladder control medications, antipsychotics, and certain pain medications, notably including muscle relaxants. What elevates this issue from a mere inconvenience to a genuinely dangerous health concern is a critical pharmacological concept known as anticholinergic burden. This term refers to the cumulative neurological effect exerted by multiple medications that, either intentionally or as a side effect, block the action of acetylcholine, which is an absolutely key neurotransmitter vital for numerous bodily functions, including learning, memory, and autonomic regulation. Numerous large-scale studies have unequivocally linked a high anticholinergic burden to an accelerated rate of cognitive decline and a significantly elevated risk of developing dementia. In this context, the dry mouth itself is not the ultimate endpoint of the problem. Instead, it serves as a visible, tangible signal, a profound external indicator of something far more insidious and deeply damaging occurring within the body's intricate internal systems, particularly the brain. I recall a patient, a retired gentleman in his mid-70s, who vividly described waking up every single morning with a sensation as though he had literally swallowed chalk. He had been on the same combination of medications for many years, a regimen prescribed by various specialists over time, yet no single prescribing doctor had ever comprehensively reviewed his full list of medications together as a unified whole. A thorough medication reconciliation, a meticulous process of evaluating all his prescriptions, ultimately identified two distinct drugs he was taking that possessed overlapping anticholinergic effects. Crucially, safer and equally effective alternative medications were readily available for both. We proceeded to make those two strategic substitutions in his medication regimen. Within a mere few weeks, he distinctly noticed a profound difference in his oral comfort. Within 2 months, he joyfully reported to me, "I wake up feeling like a normal person again, and my thinking feels sharper than it has in years." This remarkable improvement was no mere coincidence. It was a direct and undeniable consequence of addressing his anticholinergic burden. Here is your actionable plan, designed to empower you starting tonight. Firstly, discontinue the use of any over-the-counter sleep aid that contains diphenhydramine. Melatonin, in a low dosage of 0.5 to 1 milligram, offers a far gentler and often more effective alternative for promoting healthy sleep. Secondly, make it a habit to run a humidifier in your bedroom, maintaining a consistent humidity level between 40 and 50%. Thirdly, consciously front-load your hydration throughout the afternoon, ensuring you consume sufficient fluids well before bedtime. Fourthly, brush your teeth before bed using a fluoride toothpaste specifically formulated for individuals experiencing dry mouth. And finally, consider trying a nasal strip tonight to promote nasal breathing. Then, during the upcoming week, meticulously compile a comprehensive list of every single medication you currently take, both prescription and over-the-counter. Bring this detailed list to your doctor and engage them in a direct, informed conversation. Ask them specifically, do any of these medications suppress saliva production? And are there alternative options available that would not have this side effect? Remember this profound truth: you are not broken. Your understanding, your information has simply been incomplete. And starting right now, that fundamental aspect changes. If this video has provided you with valuable insights and helpful information, please take a moment to smash that like button. Consider subscribing to this channel for a continuous stream of real, evidence-based health solutions, meticulously designed specifically for adults over the age of 60. And most importantly, please share this vital message with someone you genuinely care about, a friend, a cherished family member, or a spouse. Your simple act of sharing might just provide them with that singular piece of information that transforms everything for their health and well-being. Finally, I am genuinely eager to hear from you. Which of these 7 causes surprised you the most? Which one resonated with you, making you pause and think, that might be me? Please share your answer openly in the comment section below. I truly value and want to know your unique story, because remember, aging does not strip away your body's intrinsic ability to recover and heal. It merely serves as a poignant reminder to care for it in the most informed, proactive, and correct way possible. Take exceptional care of yourself.